we've had a lot of change in North Carolina. A lot has happened. DSP wages have increased a little bit since 2019, but they remain very low and below market value. We have a healthcare system in this country that is privatized, it's for profit. It has a care model and it relies on this free market. But the main source of funding for the services that we need, especially in the area of disability supports and services, comes from the government-controlled tax dollars, and that makes a sort of unique fit between this public system and this sort of privatized system. And we'll talk a little bit about that. And of course, the issues around innovations, waivers, DSPs, and direct support staff aren't the only workforce shortage that's affecting people with intellectual and developmental disabilities. And I really do believe that providers of services and people who need services do need to work closely together to advocate for the change and for the things that we need in this system. We have an incredibly fast-growing state. The state has added more than 2.6 million people since the year 2000. That's roughly 25% more people than were here when I moved here. Enormously fast-growing state. We've had a huge growth in needs. So there's been an increase in people with intellectual and developmental disabilities, and in particular, those on the autism spectrum. People with IDD are living longer, which is fantastic, but it means their families are aging. It means they themselves need a continuum of care throughout their lifetime for a much longer period. There has been an increased demand for community-based living and community-based services, and this is, we have an increase in rights for people with disabilities, awareness of those rights. People want to live in a community setting. Their families want folks to be integrated into their lives, and people want to live the lives that everybody else is living. We've had decades of reforms in North Carolina. These reforms have, I believe, in a lot of cases, improved things in North Carolina, but they've also created a constant state of change, which I believe is really deterring interest by those in joining the workforce that's dedicated to intellectual and developmental disabilities, as well as that dedicated to behavioral health, substance use services, mental health services. And North Carolina has a really long history of underfunding human services in the state. Historically, it was there was tremendous poverty in the state. It was an agricultural-based state with low revenues, and it spent a lot of time catching up to other areas of the country. And currently, there's a big focus with the current political viewpoints of lowering taxes and funding other priorities, which means there's been a significant lack of investments in intellectual and developmental disability services. I just want to note too that in that time frame, we're adding about 750 people a year to the Registry of Unmet Needs, so folks who are in need of innovations waivers. There's been fewer slots added every year than there are people being added to the list for all of those reasons that you saw: population growth, growth in people with IDD, growth in demand. And so we're only adding probably around 250 to 300 slots a year, which is not meeting the need, not meeting the demand. The average wages, when the last time we did a study on this, were $11.50 an hour, and that was in 2019. And since that time, a few things have changed a bit. We've gone through a global pandemic. During that pandemic, there was a tremendous amount of funding coming from the federal government to states to support people who were delivering healthcare services, were doing direct care services. Some of this funding was to be able to retain people when they couldn't do work in person. Some of this was to support the cost of all these virus precautions that we were putting into place to keep people safe. They also went toward, in North Carolina, increasing provider rates and paying bonuses to DSPs because people were continuing to deliver services directly to people in the midst of this pandemic. We've had other changes as well, including things like electronic visit verification, which requires providers to electronically check in to assure the public payers, the Medicare and Medicaid, that those services are actually being delivered. And providers who are doing that also got an increase in rates. So rates went up a little bit. DSPs got some bonuses during that time frame. But in 2022, those COVID enhanced rates started to go away. And so the General Assembly did provide funding to increase Innovation's waiver direct support professional wages. And due to that increase, providers were able to start paying direct support professionals, especially in Innovations, a little bit more money than they were before. And the increases come out to between $13 and $13.50 an hour, depending on the provider. So another rate study was done in March of this year, and it showed that the average wages right now for DSPs in Innovations, specifically in Innovations, is $13.12 an hour. And another 87 to 93, so we've been rounding it to 90 million, is needed to increase those wages to about $18 an hour. So study came out. The budget did pass in September, late September, early October, and it did include $60 million for Innovations DSP wage increases. And that $60 million will draw down money from the federal government to help cover the cost of that increase across that service. We are waiting for the Division of Health Benefits to determine the new base rates for Innovations. And we were certainly hoping that things will get close to that $18 an hour, but given that there's a gap between what we thought we would need, which was around 90 million, and what was allocated by the General Assembly, which was 60 million, that we may not get to that $18. We'll have to see how that works. So what happens when rates increase? What are those rates paying for when that money goes to a provider? And I want to just say that I am an advocate for people with developmental disabilities, but I also work for an organization that directly provides services. So I just want to make that clear so nobody's confused about that. Those rates, that funding that goes to the provider, pays for the DSP wages and direct support staff wages, pays for folks who supervise them and support them, pays for payroll taxes, and in some cases, employee benefits when that's possible, transportation costs, the cost of recruitment and training of DSPs. So that's all those folks in HR, advertising, interviewing, background checks, medical testing, other things that are needed to hire people. Training. I know that a lot of DSPs feel like they don't get enough training, and I would agree that I think training is critical to have good quality services, but there are required trainings that providers have to make sure that DSPs get, things around safety, around CPR, around working with clients, around the use of technology that may be needed to document their work. And then there are administrative costs for providers. This is admin staffing, payroll, contracting, billing, data collection. We're all required to bill and collect data, licensing, quality control, a physical location for most providers, so an actual building and rent and upkeep. Communications, so that could be your phone system, your internet, all of that, responding to people and responding to the public, and other regulatory compliance that we have to do as providers. And then there are other costs associated with some of the specialized services as well. So a lot goes into providing a service beyond just the wages of the direct support personnel. And I want to just say that the way North Carolina has structured its system, all of the providers in our system are private providers. So some of them are for profit, some of them are nonprofit. But the role of our government in this is to pay for services and to oversee how those services are delivered, to make sure they're delivered appropriately, to make sure people have access to them. But providers are privately funded. They are part of this free market system that we have in this country. That creates some tensions. The government controls all of the funding, sets the rates, determines how much those services are worth. But private providers operate in the private sector, which means they might have contracts with other insurance companies. They might have people who pay privately for care. That's how our healthcare system operates in this country. But you can see that sometimes the government sets a rate that doesn't necessarily meet those providers' costs. And that's where some of that tension comes in, is they're trying to use public dollars very wisely and serve as many people as they possibly can. But providers also have to continue operating as a business, and they have to be able to pay employees and keep their doors open in order to continue delivering services, not just to maybe folks who get Medicaid services, but folks who get all kinds of other services as well. And that can be very challenging. And I want to just point out, and we've had a lot of discussions about this issue over the years, is innovations isn't the only workforce shortage that's going on. And we have DSPs that work across many services. So we have other waivers in the state, CAP, TBI. We have state-funded services. We have services in aging and home health. There are B3 services and employment services, all of whom use DSPs to deliver direct care to people. There's shortages in the state of dentists who will take folks on Medicaid. It's a result of low rates and a lack of training. We have shortages of psychiatrists and psychologists. We have shortages across mental health and behavioral health. And many of these other services have pressures that we talked about at the start of population growth, low rates, and struggling to get people interested in staying in this workforce, in this arena. I really believe, as I said at the start, that providers and folks who are in need of services need to be working together and advocating together for those increased investments in our workforce, increased investments in services and in policies that make sure that people are able to live in their communities that they want to live in, and do that in a really equitable way. I believe very strongly that advocacy does work. I don't think that $60 million for increased rates in innovations would be in the budget if we weren't all advocating together for that, as well as other things that were in the budget that all of us have been advocating for, in particular the last decade, but some of those things we've been advocating for even longer than that. And really there's nothing that folks with disabilities and disability advocates have gotten, all of these changes that we've seen over the last 20, 30, 40 years, there's none of those things that have happened without a fight, without advocacy pressure. And I believe incredibly strongly in people's ability to advocate for themselves and advocate collectively for that change.